Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Happy Q&A day. We do like to celebrate wins in the program also. This week, I would love to highlight who started the program at 62 out of 132 and is down to 7 in only 3 months. So congratulations to Carson. And who started the program at 85 out of 132 and is down to 8 in 2 years. So congratulations to both of those members.
Any interesting cases, Melinda or Cam, that have come across your
Well, I
your
was just
live?
looping in on our my Tuesday live was a really rich discussion around accountability. And that was kind of a neat thing that Nikki posted for us in the news feed was, maybe one of the ways we can keep each other accountable or members can keep each other accountable is to support each other, using our community. So one of the things that Nikki's always inundated with is people that, are finding it challenging to get out for that walk or challenging to do an exposure or just, are feeling like it's hard to stay consistent with some of the things they're trying to stay consistent with. So I know Nikki and I were enjoying that conversation. Oh, it was in my presentation last Thursday. Yeah. So we've now posted that on the news feed for anyone who wants to jump on. I was actually just writing a post here to kind of give some examples of things that had come up during the presentation. We thought it could be a helpful way just to help boost our encouragement to each other. Sometimes it helps to kind of get you up and moving in the cold weather. For a lot of us, it's winter right now. To have, another member here right in the Concussion Fix also kind of getting out for those walks or going to the grocery store, whatever your challenge might be right now. So that could be something we could chat about a little bit.
And celebrating when we do take that step, right? Like I know we got about a foot of snow last night, another 6 inches of snow the day before. So like you said, going out for those walks this time of year can be a little bit more daunting to think about. And posting when you do have that walk, it's great to have that encouragement, that celebration afterwards as well.
Yeah, I think that was sort of the theme that came out of my presentation last week was there's a lot of members who know what to do in the program, but finding that motivation, particularly during colder months or seasons where it's a bit quieter or dark early, it can be hard to prioritize those things that help you, which makes a lot of sense, right? I think we all struggle this time of year, especially if you're in a place where it gets dark at 4:30 like it is here, 5:30, and there's not as much sunlight, the weather is cold. It can be hard to kind of keep up with your rehab, with your, intentions that you've set out from the program.
For sure. I'm doing a webinar later this week and also next week about kind of like how to combat the winter blues and how to manage stress throughout the holiday season. So I'm sure that's on a lot of people's minds. I think especially people that have concussions, they're struggling with, okay, so how do I manage going to a party where there's lots of people? And, there's always a challenge with overstimulation. And what about diet? Can I kind of like change up my diet if I'm following the concussion fix? So, I mean, I think there are some things that right away you have to be careful of. I see Cam put on his bright light. I don't know if you put your, is that your morning happy light that you put on there?
Yeah, I've noticed that I'm having like trouble falling asleep for the past like few nights, and I'm wondering
Ah.
if, and so I was like, I got to start doing that. And then you mentioned it, and so I just clicked it on.
There you go. See, Cam knows exactly where I was going with this. But one of the best things actually is having exposure to morning light and using a light box like what Dr. Marshall just turned on is is one of the best ways to combat that. So right around, yeah, it's called a sad light or a happy light.
Happy light.
Um, and it stands for SAD because it's the seasonal affective disorder. So this is a condition that happens when you experience a real substantial decrease in mood for at least 2 seasons when the seasons change, when it basically gets darker, right around in the northern hemisphere, right around November. And so that's a really common thing that people experience. Some people experience it more, some people less. But it's normal to find a little bit of sleep disruption, a little bit of mood change. But if it kind of clinically impacts you, where you actually now start getting overall like actually depressed, then that is going to be one way you can combat it. So, just exposing yourself to at least 15 minutes of a light that's about 50 centimeters away, which you can kind of think is maybe the length of your forearm. You kind of want sitting there on your table, just like you can see one side of Dr. Marshall's face. He's not looking directly at it. It's off on 45 degrees. And then you want to have it about at the 10,000 LUX or lux strength. You can work your way up to that. You don't have to jump right to that. It's about $30 to $50 for one of these lights. It's available online, and it's quite easy for people to get a hold of. Go ahead, Ken.
Yeah, there was a study this month, right? So, um, and it was a review. It was a critically appraised topic on blue light therapy in people with PCS.
Hmm.
And so basically the summary, the key findings here is that morning blue light therapy has a positive effect on circadian rhythm and resetting sleep regulation in people with PCS. Morning blue light therapy associated with objectively greater daytime alertness and reduced tendency to doze off. Blue light therapy was more effective than morning amber light at shifting sleep-wake periods, reducing subjective and objective daytime sleepiness. Um, Basically, yeah, reducing fatigue, improving sleep, so on. So there's some good evidence on morning blue light therapy
Yeah.
for concussion and PCS. So it's just top of mind because it was a new study this month.
Yeah.
Someone's asking in the chat about red light.
Yeah. So
Red
red
light for
lights.
nighttime.
Yeah, it's pretty popular now, and it's actually a great conversation to have around light in general because we're not getting much of it here in Southern Ontario, where we're at in Canada, and a lot of people again in the Northern Hemisphere this time of year. In the equator, it's a little bit more balanced, so you're going to have a little bit more exposure. But there's light is super important for regulating your entire circadian pattern. What is that? That is your sleep-wake pattern. That is, I'm alert in the morning and I'm sleepy late at night. Now, when it gets darker and darker, now you are not going to be maybe waking up with the sunshine as easily. It's colder, we're indoors. And now what happens is that your sleep suffers because now your body's having a tougher time to figure out when is night and when is day because it all kind of runs into each other. So some people get up, they leave when it's still dark, and they get home and it's already dark, and they don't really get any natural light. So your brain is kind of like going off all the fluorescent stuff, which is not in any way, shape, or form a good form of light. In fact, for most people with concussions, it actually can be quite symptom triggering, and we've talked about that at length for a whole bunch of other reasons. So morning light can be partially replaced by this light box, but ideally it's getting up and going for a walk and getting that natural light. Now, remember, this has nothing to do with vitamin D. This has nothing to do with getting that sun exposure. That is beneficial for a whole bunch of other reasons. We can't do that here where we live, but you can still get the benefit without throwing those sunglasses on right away and going for a walk. If it's crisp and cold, like -10 right now, you can still get that benefit because it's light into your eyes. The red light is exposing your body and your eyes to the longer wavelength light. So the yellows, the oranges, and then the reds. And what this does is that it actually helps our body's energy production. There's these little things inside of our cells called mitochondria, and they're basically the energy power plant producers, producing ATP for all of our body. And what happens is that when we start getting exposed to this light, especially in the summer, in the afternoon, basically after 3 p.m., your body doesn't make vitamin D. So if you're out after 3 p.m., it's not as bright out. Of course, you're not going to get sunburn. That's a big benefit on that exposure, but you're getting a whole bunch of other benefits. In a sense, the sun charges up your cells when it's exposed to red light. So now companies are using the red light approach of actually putting it over areas of the body that need extra energy production, like sore knees, or in fact, there's research showing that you can expose your body to it, like your chest, and it improves vision because of that mitochondrial effect. So it's not just like you have to look at it. It's not the same principle as actually having that light box that Cam just talked about, but it's just exposing different areas of the body to have those beneficial effects. There's research on skin health, on collagen function. It also kind of like, again, has a global beneficial effect on mood with having bright natural light in the morning and redder tones in the evening. Basically, what we're trying to do is we're trying to mimic the sun without actually having it around and not getting the vitamin D. So that's the benefit of the red light. Final thing I'll say about it, the whole category of research is called photobiomodulation, fancy way of saying light to help support your body cells. We've talked about laser therapy for concussion recovery before in this on this podcast. We've also talked about it very briefly in some of the lives. I think the research is still out for lasers on concussion recovery, but I have seen, and this is just my clinical experience, that some patients that have a tough time tolerating some other more aggressive therapies, like for example, acupuncture, getting laser has actually been very beneficial for some of them. And it's not just about like I'm going after one muscle trigger point in my neck. It's also about this whole mitochondrial function. And so there's different approaches. So laser is a more specific and stronger version of what you get in the sun and also in like a red light box or panel. So that's just a more therapeutic version of that. I don't know if Cam or Melinda, you want to add anything to that.
No, not really. I mean, I think there's, I look at the research just from a concussion perspective, and there really isn't much on it yet, but it's becoming a more popular topic. So
I think like the mechanism makes sense though, right, Cam? Like I think that it's like right now we need more evidence for it, but we still don't fully know like magnitude, how much, all that kind of stuff. But I think from a mitochondrial perspective and what photobiomodulation does, I think that there's some potential, and I'm excited to hopefully someone starts researching it.
yeah, the thing that gets me, I mean, I think that like more like whole body red light therapy is probably good for those benefits that you're talking about. Whatever I see it though, it's like they have these lasers like directed at the skull itself. And the research shows that you can't penetrate the skull really to any meaningful effect. So I feel that like a lot of the things are kind of gimmicky on around the concussion side of things. Like for example, we see the same thing with like cooling. Right. So there's evidence to suggest that immediately after a concussion, if we can cool the body temperature down, that reduces the amount of glutamate released. And the amount of glutamate is directly proportional to the amount of mitochondrial dysfunction that happens after a concussion injury. So right after a concussion, if you're in a sports setting environment, if we could cool the body down immediately, we could potentially improve outcomes.
Hmm.
And a lot of the research shows this. Now, then you'll have groups that come out with cooling devices that are like a cap that goes on your head and it delivers cold water through the cap. Well, I don't think that's the most efficient way to cool the body down, right? You'd be better off to throw somebody into an ice bath or put ice packs in their armpits and their groin in areas where you're able to actually effectively reduce that body temperature. But because it's a cap on the head, it has that kind of gimmicky thing where it's like, oh, you're cooling down the head. Well, no, the better way to cool down the head would be to cool down the neck and the blood going into the head. That would be a more effective way to do it. Same thing, I think, with like laser and red light. I think that overall, there's probably a global systemic impact of this that's going to be more beneficial than some device that goes on the head that tries to put lasers through the skull because you're not going to penetrate anyway. So you know what I mean? So I think there's like some gimmicky type devices out there that people go for because they think, oh, this laser is going to like get in and affect the metabolic function of the brain itself. But I just don't think that's the best way to do it, just because you can't penetrate the skull with it.
Yeah, I mean, I always think about also being cautious with what's trendy, right? Red light therapy is so trendy right now. So then so many
Mm.
companies put out new devices, and you want to make sure that whatever one you're choosing has good evidence behind it. There was even this week on another topic, there was a lot of questions in the chat about different stim devices for mental health, and there's just so many different companies out there that create these medical devices, and I think it's important to do your research and figure out which one is going to be reliable, which one's going to be effective, which one has evidence behind it. I think it's no different with the red light therapies as well.
Yeah. I mean, I guess just to play devil's advocate, I wouldn't want the laser to penetrate the skull because we know concussion is not really after the initial phase is not a brain tissue problem. It's a systems issue. So that's where I think like you said, the mitochondrial benefit that's more global probably was going to be more beneficial. I mean, I can just speak based on my clinical experience that, we were working with patients that really were not responsive and they went and this is the only variable they changed. They found actually low dose naltrexone was one game changer for them and also doing laser therapy. And so they were doing laser therapy specifically around their neck. They were putting it across kind of like the occiput area, which is the where the skull attaches to your cervical muscles. And we know that there's a lot of dysfunction in this area. And then that's where, this person didn't respond well to manual therapy. But once they started putting these kind of like, it was almost like a banded laser device, a medical grade laser, they were starting to get some really beneficial effects. So I found that was just fascinating. Um, okay, Nikki, is there any questions? I know no one's put their hand up.
Yes, there's the question from earlier. So they say, I've had a second concussion and I'm frozen in fight and flight. Everything aches and I do still feel fatigue and groggy. It has been 2 months since I flew into a corner of a wall head first, and I'm wondering if there's a timing on when it's okay to start getting chiropractor work or do procedures that require anesthesia. Like, do I need to give my brain more recovery before I start doing other medical things?
All right, so I'll start, I guess. You can kind of go two ways with this, right? So we always recommend that you do things in order, right? Like you want to build that foundation in terms of the concussion recovery pyramid. Rehabilitation manual therapy tends to come at the end. And the reason is because if you're stuck in fight or flight and you have some neck dysfunction, the neck dysfunction might be driving some of that fight or flight, but also manual therapy can sometimes send somebody that's in fight or flight further into fight or flight. So that's why we want to work on like doing things to regulate the nervous system and building um, resilience within your system, but also developing some of the tools to help bring your nervous system back into balance so that when you do get treatment, if it starts to flare you up, you have the tools and resources that you can call upon to help kind of regulate yourself during and after that treatment. If you just go full bore into it and you're not ready for it, it can make things worse. So that's why we typically recommend you follow the order and the structure that's in the program so that you can develop those tools, start to kind of calm things down, start to rebalance things, start to reduce inflammation. And then when you go for treatment, it's more likely to be effective and not to send you into a loop that makes things worse. Now, because the neck can also cause some autonomic dysregulation, sometimes getting early treatment can actually be beneficial and can actually help to speed up the process. But you never know which camp you're in. So there's kind of a risk. So you can go about it two ways. You could say, all right, I'm just going to work through this pyramid so that I don't flare myself up. Or you could say, I'm going to work through this pyramid, but I'm going to start in with manual therapy earlier to see if it's helpful. But just be aware that it can sometimes trigger an autonomic response. So you can go about it either way, but there's probably more of a risk for flare up if you go too early. But also it may work out the other way, and you might be one of those people that actually it helps speed things up. So it's really kind of trial and error. We don't really know. There's no real way to know how you're going to respond to it. Now, in terms of procedures that require anesthesia, there's really no good evidence on this. Sometimes procedures that require anesthesia can flare things up. Sometimes there's no effect. And I've even had patients before that have gotten a procedure requiring anesthesia and say that all of their PCS symptoms went away after the procedure. So I don't know. It's kind of, we don't really know if there, like, when there's a time that you can do it, but we have to think about what's going on during that procedure. Because procedures like a surgery, for example, yes, there's going to be anesthesia, but also there's going to be a massive inflammatory component to that procedure, right? If they're cutting tissue and getting into, doing something surgically, there's going to be an inflammatory reaction to that. And if inflammation is one of the drivers of your symptoms, then that inflammatory response can obviously make those symptoms worse. So is the anesthesia the problem, or is the surgical procedure the problem? And I don't think we really know which one it is. So I think it would depend on what the procedure is, right? Like if let's say it's a minor dental procedure and you're getting some local anesthetic, that's probably going to be less of an issue than if it's a knee replacement, for example, like where there's going to be a lot of, banging and poking and sawing of bone and things like that, right? So I think the procedure might matter more than the anesthesia. But again, you could get to a completely asymptomatic point, and then, like we talk about the concussion cliff scenario, you get to a completely asymptomatic point, but you still have, inflammation bubbling below the surface. Your symptoms are gone, but there's still this kind of dysfunction there, kind of subclinical, we'll call it. Then you go and get a procedure done, and then all your symptoms come back because of that inflammation just kicks up, and now you're back kind of off the cliff. So it's not necessarily like waiting for the perfect time to do this, because at any point in time it could potentially flare symptoms up. So we don't know if it's the anesthesia, we don't know if it's a surgical procedure or what. And so far, just anecdotally, because we don't have really good scientific evidence to show us this, but anecdotally, I've heard the whole gamut, right? Patients getting worse, patients having no effect, and patients actually getting better. So we don't really know. But if there's a surgical procedure that needs to be done, you kind of have to, obviously if it's something that's necessary, like you need to have heart surgery, like go for the heart surgery because, the PCS is the least of the worry, right? So it's always this cost benefit analysis that you have to run for yourself.
Yeah, I was just going to say there, like it's all just different types of stress on the body. So if your resources to cope with stress are low, then the likelihood is that following a stressful event, it's going to be hard to recover. So this is a sort of cumulative effect of concussion, right? So if we have a concussion, our stress is high following that incident or following that injury, then we do something stressful again, or another stressor happens to us. These are all compounding, they're accumulating one another, and it creates more stress in the body. So sort of this foundation of our course is let's build up our resources to cope with stress before you add any more stress, just to kind of
Yes.
simplify it. Yeah.
That's a great way to describe it. Very well said. Like getting manual therapy, getting your work done by a chiro, for example, is a stressor. Having a surgical procedure done, stressor. Okay. So, like Melinda said, if we don't have the tools available to us and we're already under stress, right? Trying to get back to work, financially things are getting tight. Well, like these are stressors on our system. And if we're not able to kind of work through those, adding that additional stressor is potentially not a
Yeah.
good thing.
Like from the work that I do, which obviously I look at a different angle than both Dr. Kim and Dr. Paul, which is why it's so valuable to have the three of us here thinking about things from different sides. I always think if the first thing someone says to me is I'm stuck in fight or flight, then that's a sense, or that's the feeling they have in the body, then that's a sign like let's work on building up your resources to cope with stress before taking on any more stressors. So, I often think people are very intuitive, even if they don't think they are. If the sense is that you're stuck in fight or flight, then you're probably having a heightened experience of stress and not enough resources to cope with that stress.
I have another question here. I was recommended homeopathy from my naturopathic doctor, but since it contains alcohol and sugars, I'm not sure that it goes well along with the concussion fix diet that I'm following. Are the amounts too small to be any significance, or is it better to not use homeopathy?
No, I've had this question before, and so I think that the amount that you're typically exposed to in homeopathic remedies, they usually are either alcohol-based or they use pellets, which are a sugar base, lactose, basically. So you want to avoid it if you're lactose intolerant. But generally, very small amounts. I it definitely was not. It's not going to ruin the concussion fix diet, that's for sure. So don't do it. Don't avoid it because you think it's going to somehow disrupt that. Those are tiny amounts and not a big deal at all.
Someone said something interesting in the chat there around following surgery. Someone's PCS symptoms disappeared entirely for 2 weeks, believing it was due to the anti-inflammatory IV you're given after surgery. What's your take on that, guy? It's kind of interesting.
I'm not sure exactly what the anti-inflammatory IV would be. Usually,
Antibiotics, right? Usually they give you.
yeah, I mean, exactly that. I mean, antibiotics have these kind of what are called pleiotropic effects, which are like broad action. We kind of found out about them a little bit during COVID, where they were being given for viral infections, even though there's no bacteria present. They were showing to be starting to be effective. So I think that's probably what happened there. And maybe this person's struggling with a chronic infection that's overlapping underneath. It could have been present before. That's possible. So yeah, that's the only mechanism I can think of. Definitely anesthetic. Uh, you know, there's something called neural therapy, which has been around for decades, which is injecting things like lidocaine into areas that have a muscle trigger point. And the mechanism, I guess, rationale is that it's meant to kind of reset uh, the threshold of the nerves in that area. And so again, lidocaine and marcaine and bupivacaine, these are anesthetics that are short acting. So they'll, just like a dental anesthetic, it goes away after a couple hours. Uh, Usually the pain comes back right away. So that's kind of the idea. So I don't think it would be that from an anesthetic. Generally, anesthetic has a deleterious effect, a negative effect. But I think it might be that what you're describing. It could be also just like hydration IVs that people are just
Mhm.
like kind of dehydrated and just getting those lactated ringers, which are it's just an electrolyte formulation that's given a lot. That could possibly be having a we really underestimate the effect of hydration, I would say in general, in my
That's a good
experience.
point.
Yeah.
Hmm.
This one's interesting too about, because we get this question a lot is I have to get a colonoscopy and I'm delaying it because of my PCS, right? And I saw
Yeah.
you post something recently on the news feed, Dr. Hrkal. Maybe you want to just talk about that and like the prepping procedure and
Yeah.
the procedure itself.
Yeah, so basically, a colonoscopy is something that's obviously done to image and look at the lower colon. So it doesn't reach up into your stomach. That's what an endoscopy is, or gastroscopy. And so it's quite common. It's a common procedure. Unfortunately, it's a pretty invasive procedure. Like it's literally inserting a probe up through your anus into your rectum and then actually going and taking a look at your mucosa. And in order to do that, you have to actually clean out all the feces out of your intestines. And so there is, usually for about 24 hours, 48 hours before. It's like you don't eat and you're taking a laxative. And basically, you're just like flushing yourself out. And then there's lots of times I've had patients that, they've had to go back and redo the flushing procedure because they're like, oh, we tried to do the colonoscopy and we couldn't see it. You're not clean enough. Go back. And so it is pretty draining anytime you do that. Just like having diarrhea for viral or bacterial reasons, it's going to be dehydrating. So hydration is a really important thing on recovery after that. Um, so so then, that's the prep procedure. It's interesting that some people going through that prep procedure, if they have a history of being constipated or they're really kind of like backed up, it actually can have a bit of a beneficial effect because it's kind of like a internal enema, just kind of like getting them clean, and then you almost have to reset. Everything that we understand is that the microbiome is still present microscopically. It's not like it's like gone totally, but that can be a little bit of a reset. And you should be using probiotics and good prebiotics, which are fuel for your bacteria after you go through a colonoscopy. Uh, in really rare cases, you can get like a perforation of your colon because they sometimes will go in and actually take like little biopsies. They'll cut out polyps, and then and then that can cause, again, very rare, but there can be some damage that happens after that. And then, I would say finally, the anesthetic, right? We just talked about that already. So that's obviously a possibility. So, I mean, overall, a common procedure, often done for screening for colon cancer or chronic lower digestive tract issues. But, know that you really have to hydrate and get some good probiotics in after the procedure is finished. Saying here in the chat, I was given large doses of ketorolac, which is an anti-inflammatory, as well as double doses of hydromorphone. So hydromorphone is not anti-inflammatory. That is an opioid medication. It's an anti-pain medication. There is, other than blocking pain, there's no real beneficial effect. Ketorolac is a very strong anti-inflammatory, usually given injectable or IV. And so sometimes when you have kind of like you're stuck in an inflammatory cycle that's quite acute, for example, like a bursitis, then giving an injection of hydrocortisone or ketorolac, almost like resets that a little bit and dramatically reduces that inflammation and your body's own homeostatic balancing systems take over after. So that could be maybe the mechanism. Mentioned something about prednisone or another very, very strong anti-inflammatory. In my experience, after surgery, it's not something that's given often, but it is possible to do. Definitely, if you have an inflammatory condition that's acute, it's absolutely done. And then, it's kind of like what's called crash course. You're doing prednisone and you're like bringing the level down really, really quickly. Every doctor knows you can't be on that stuff long term or shouldn't be because there's a lot of detrimental effects like, you can't sleep and bone mineral degradation and all sorts of other things that start happening.
Well, you also need a level of inflammation for healing.
Of course, yeah, 100%. These are cases obviously that I think that the level of inflammation has gone past the body's ability to kind of resolve it. So, like in COVID, for example, people were giving these types of dexamethasone, anti-inflammatories. This is a steroid, but it was life-saving because it was decreasing the very strong inflammatory response. Ideally, we want inflammation to resolve itself through our own resolution mechanisms. That's why omega-3s are so valuable, is because they really pump up those resolvins and marzins, which are these resolving factors. However, there are examples that in kind of emergency medicine where you need to use this to stem that inflammatory cascade. Has her hand up. I don't know if there's another one, Nikki, that we want to do in the chat.
No, we can go to first.
Okay.
Good afternoon, guys. Oh, it's morning at your place.
Afternoon for you.
Sorry for that. It's afternoon here. I have a question about my shoulder muscles, the trapezius, the
Okay.
big ones. The last time I asked questions. The explanation was that the big muscles take over the smaller ones when things are not so nice there. So I'm working on getting the trapezius more relaxed. So the smaller muscles in my neck, they have to learn to work again. And it is getting more relaxed now. My neck is more tired, but I can understand that because the muscles haven't worked so much. So I was wondering, I have two questions because the muscles in my jaws are still very tight. I do some exercises for that, but I'm wondering what kind of exercises will work to relax them more. And the other question is, I did build a topspin 360 myself with a biker's helmet, and it seems to work. And what I understood is that it's helping the smaller muscles in the neck to become stronger. So I was wondering if I should start with that when the trapezius is more relaxed, if that's a good order of exercising. So that's the two questions.
I'm interested to how you built this.
Yeah.
I can show you if you want.
I would love to see it. So, okay. Trap tightness can be, a lot of times it's just due to postural issues, right? So muscles that are more like prime movers, like we're talking about like the SCM muscles and those types of things, often will take over for smaller stabilizing muscles if the stabilizing muscles aren't doing their job. The traps, however, like are huge, right? The traps go all the way down to your mid back, then they go up to your shoulders, then they go up to the base of your skull. So it's this big kind of diamond shape muscle. You have upper, middle, and lower fibers of the trap. And they fire at different times and for different reasons. The lower fibers of the trap are designed to pull your shoulder blades back and down. The middle fibers of the trap are designed to pull your shoulder blades back kind of close together. And then the upper fibers of the trap are designed to kind of lift your shoulders up like this. And frequently, when people have upper trap dysfunction, it's because they have rolled forward shoulders and their shoulder blades go up like this because they're being pulled forward, usually by tightness in the pecs. And they usually end up with an anterior head carriage, right? Like if my upper back curves too far forward, my head is going to be looking at the ground. And then so to counteract that, I'm gonna bring up my neck like this. So usually you end up with like suboccipital issues, you end up with weakness in the deep neck flexors. You have this rolled forward shoulder posture. Now, because my shoulders are rolled forward, my upper traps are kind of engaged and doing that. My lower and middle traps are usually weak. And that's why my upper traps are winning the battle. So, in terms of fixing this issue, it's usually trying to do things to get the shoulders back and down. So, doing exercises like that are in the program, we talk about Ys and Ts. Ys and Ts are designed, the Ts are developed or are used for the middle trap fibers. The Ys, as you pull your shoulders back and down and squeeze them together, that's designed to activate the lower fibers of the trap. Then it's doing things like stretching or soft tissue work through the pecs to try and reduce the tension that's on the pecs, right? Stretching the pecs, pulling the shoulders back and down, because as your thoracic spine gets out of that curvature and more upright, then your neck isn't forward like this. It allows you to pull your neck back into a more neutral posture. So usually it's not just exercises, but it's a combination of manual therapy and exercises. So you want to be able to do some soft tissue work to work on the deep neck flexors, work on the SCMs, because the SCMs will also pull things forward. Then you want to do strengthening for the lower traps and the middle traps to bring the shoulders back and down to get you into a more neutral kind of position. So usually it's like this tug of war between upper traps and lower traps, and the upper traps are typically winning that battle if there's a postural issue like this. So you want to do things, stretch the pecs. You want to do things to bring the shoulders back and down. So that's strengthening the lower traps, middle traps, and loosening the pecs to reduce that tension, but also working on things like deep neck flexors and then getting some soft tissue in the suboccipital areas and the SCMs to reduce that tension that's pulling the head forward. So there's a whole kind of systems approach here to try to bring things back into a better, postural system. So usually tightness in the upper traps is due to mostly postural strain.
And do you do all these things together, or is there an order?
No, it's usually together. I usually like my process for this with a patient is I start first with loosening off what's tight. If I loosen off what's tight, things naturally will start to work better. Once I have things working better, so usually what I would start off with is I would do some soft tissue work in the deep neck flexors. I do some soft tissue work in the SCMs. I would do some soft tissue work in the suboccipitals. I would do some soft tissue work in the pecs. I would do some soft tissue work in a muscle underneath your armpit called the subscapularis muscle. All of that helps to kind of bring everything back into a better position. After I do that for a few weeks, we're starting to notice we're probably getting pain reduction. We're getting less headaches. We're getting less dizziness symptoms. These are all good things. Things are moving better. I'm not finding as many kind of dysfunctions in terms of people's movement patterns. Okay, now we start strengthening. So I usually will start off with at least 4 to 6 weeks of manual soft tissue work first. Once things are working better, now I say, okay, now I want you to start doing Ys and Ts and maybe some deep neck flexor activation to try and strengthen the deep neck. So chin tucks, right? So you're bringing your chin back, which gets you into a more neutral posture. Now you mentioned you also have TMJ issues, right? TMJ is heavily related to neck and posture because as your shoulder comes forward and your neck goes forward, your jaw automatically opens up and it creates this kind of like jaw jut. So as you bring things back into a better position, that will help the jaw, but also helping the jaw helps to bring you back into a better position. So I also will do work on the jaw. So I'll work on the masseter muscles, which are right here. So I'll usually apply some pressure and have somebody open their mouth and then release the pressure, put more pressure and keep doing that. And then also on the temporalis, which is up here, the temples. So I apply pressure to the temporalis muscles, have somebody open and close their mouth as I'm applying that pressure. And then I will take a glove, put my finger in to the pterygoid muscles, which is right up kind of at the, behind your back top molar, and put pressure there and have somebody open their mouth. That actually I see in my patients clinically is that if they have a lot of suboccipital issues and I push on their suboccipitals and that causes this headache in the front of their head, if I go in and release the pterygoid muscles on the same side, usually that will immediately reduce the amount of tension in the suboccipitals. So there's a direct connection there with how things work together. Someone's mentioning jaw clicking. Jaw clicking, usually this is getting a little bit complex, I think, but there's a disc that sits on top of the condyle of the jaw. Maybe I can show it in an image better. So if we look at this image right here, so this is the condyle of your mandible, which is your lower jaw, right? See how this right here is the part that connects with your kind of temporal bone. So this is your temporomandibular joint, TMJ. Temporal, which is this bone, which is part of your skull, mandible, and this is the joint. So you have a disc in here, okay, that is between the two. In people with jaw clicking, what happens sometimes is as your jaw opens, this condyle shifts forward, right? So think about your jaw opening like this, right? It opens and then it also slides forward. As you open your mouth wider, it slides forward. The muscles, the pterygoids right here, are designed to pull that disc forward as the jaw opens so that this disc always maintains contact with this condyle. What happens in some cases is that this pterygoid muscle doesn't work properly for whatever reason, and this condyle shoots forward and slips off the front of the disc and causes a click. And sometimes people can actually slip off the disc and get locked open. They get locked right open. And so that's usually what jaw clicking is. I'd have to like do an assessment to actually see what happens. I wonder if there's like a video here. Here's another image of it, but here's the pterygoid muscles, which are you can get at from inside the mouth. Their job is to pull that disc forward, and if they're not doing their job, this condyle slips off the front of the disc and it clicks. You can see here, this is the disc condyle right there. So again, for the clicking person, again, it's probably a pterygoid issue. That's usually what it is. Does that answer your question?
Yes, I do understand that. I have been working with a therapist, and she gave me the Y's and the T's, so that was interesting because it's the same as in the program.
Yeah.
But she's not doing the soft tissue stuff, so
Yeah.
things are loosening up, and it is relaxed, way more relaxed than it was, but it's not there yet. So I think I should search for someone who's doing soft tissue work.
Yes. Yeah, the soft tissue, and this is what I find, this is kind of my knock on on a lot of physios. A lot of physios take an exercise-based approach. A lot of chiros take the more manual therapy-based approach. And the reality of it is that exercises don't often work for these types of things alone. In isolation, doing exercises will take you, let's say a year to fix this problem. Whereas soft tissue, I could fix it in a few weeks, and then you do the exercises to strengthen and keep it there. So it's not that one is better than the other. Both are needed, but it's the timing of it. Typically, manual therapy, I find starting with manual therapy and then strengthening once you've cleared out some of the dysfunctions is the way to go.
Yeah, so I should wait. I should wait with the strengthening stuff.
You can keep doing it. There's no harm in keeping to do it, but without adding in the manual therapy, it's just going to take you a really long time.
Yeah.
The manual therapy can really speed up the process, provided that they know what they're doing and they're fixing the right things. Right? A lot of times where therapists go wrong is that you come in and you say, "Oh, my traps are tight." And they go, "Okay, I'm just going to work out your traps." Right? But the thinking clinician will say, "Why are your traps tight?" I'm going to work on the things that are causing the traps to be tight. Like if you come in with trap tightness, I'll barely touch your traps because that's, to me, in my mind, the trap tightness is a reaction to something else.
Yeah.
It's just a reaction. So if I can then fix the other things, the traps can then relax. The traps don't want to be tight. They're tight because something is kind of causing that pattern to come up.
Yeah, it's just a challenge to find the right.
I know. It's the hardest thing. It's the hardest thing for us to even recommend because I can say, go find a chiro, but then a lot of chiros will only do adjustments or they will go directly to the tissue that's bothered, right? Oh, my traps. Okay, I'm going to work on your traps. Oh, it's still there. Okay, I'll work on your traps. Okay, it's still there. Well, oh man, these traps are really tight. They're not letting go. The reason it's not letting go is because they're not working on the reason the traps are tight. Right? They're taking a symptom-based approach when you need to take a systems-based approach.
Yeah, but it means what's happening is that I have a gyro and I have a PT, the sixth one I think already, but I don't have a soft tissue person. So it's really the gyro is only doing the, how do you say, the manual stuff. The PT is only doing the exercise stuff, and it's helping a bit, but I'm not getting there where I should be.
Yeah.
So it's really
you could try like massage. You could try massage. You could try maybe osteopathy. You could try just different. This is the biggest challenge.
Yeah, it is.
Especially in Europe too. Like like in Canada, North America, like we have like a lot of ART practitioners. That isn't a thing as much in Europe. Because a lot of the training courses are done in North America. So a lot of European, PTs and chiro aren't going to fly overseas to do a course. So that it can be a challenge.
Yeah, I'll see if I can find someone for the soft tissue stuff.
Yeah.
Yeah. Thanks.
Yeah. Okay. Next up,
I have this unique cataract that I've been born with in the middle of my main eye, which is my left eye. And when I was about 16, 17 years old, I got these crooked corneas that made the cataract take much more of an effect with my vision. And after it made it more difficult for me to focus, concentrate. And this is before the concussion. So it's like I get blinded by light constantly because of it. So this made it difficult for me to, I was able to get through it. My executive function well and stuff like that, but it had a big effect. So I went to this Nemustoro, which you suggested, and they said my symptoms can be likely because of eye problems. So I went to an optician they really recommended, and they were not be able to give me vision training because of that cataract, because it heavily impacted my vision. I have constant double vision, no matter what glasses I wear, nothing. And the optician really suggested that I maybe get operated on the left eye to remove that cataract. I've thought about this for a long time, but everyone has told me like wait till you get older, 30 years old or stuff like that. The technology keeps on improving and stuff. So, I mean, it makes a lot of sense to me, at least. The optician told me like maybe it made it very difficult for me to recover from this concussion because of that cataract, which made it maybe doing tasks like mindfulness, meditation, reading, concentrating, focus, and stuff like that. And what's your thought about this? Like, does this make a lot of sense? Can it be such a big hurdle so that the concussion, the cataract had such a big effect that made it so that you can't recover fully from the concussion just because of that? Can it be something so big?
I mean, I'm not an optometrist. I'm not a eye specialist by any means. But a large portion of our brain is impacted by our visual system. And if our visual system is not functioning properly, it can make a lot of aspects more difficult, right? So if you are not able to properly see the world around you, and you're living in a state of constant double vision, for example, that signal coming into your brain is then communicating with your vestibular system. It's communicating with your neck. It's communicating with all sorts of different, your cognitive function is also influenced by your visual system. And so if you're getting abnormal signals coming in from your visual system, it can cause your body to have heightened states of autonomic issues, right? Because your body is basically fight or flight. It doesn't know what's going on. So it can definitely impact things and make it much more difficult for recovery, right? If you think about what PCS is and the way that we look at PCS is a lot of it is a reflection of your concussion condition, right? So if you had anxiety issues prior to concussion, that's one of the number one predictors of who's going to have PCS is because the anxiety is already there. Concussion is going to make it worse. And now it's going to be much more difficult to recover. If you had pre-existing neck injury, for example, you're in a car accident, years ago, and you have whiplash and some neck dysfunction, you get another concussion, it's likely that you're going to have PCS because you have pre-existing neck dysfunction that the concussion is now made worse, and now it just becomes much more difficult to recover. And I think this is probably the similar case, is that you have visual dysfunction prior to, then you get a concussion, and now it just kind of spirals everything, right? So I definitely think this could be playing a major role in your recovery.
So you also say like stuff like that, eye problems can be the main influence for you to have things like anxiety. It can be the main thing because of it.
Yeah.
Yeah.
If you think about like your nervous system isn't going to feel safe if it doesn't know where it is in space.
Mm.
right? And the main sensory thing that we have is our visual system.
Yeah.
And so all the information you're getting from your environment around you is confusing. And so I think that can trigger a lot of autonomic issues. And your eyes are very sensitive to these autonomic things, right? Like I know when I go to the optometrist and they like dilate my pupils or sometimes they'll put an anesthetic on my eye because they have to test my pressures because my family has a genetic kind of glaucoma condition, so I always have to get checked for it. They check my eye pressures. And before they do that, they'll put an anesthetic on my eyes. I go into like a massive sympathetic response to that. I get really nauseous. I start sweating. I'm just like because of that, right? So your eyes, I think, are really sensitive to that. And I think there's a big connection between your visual system and your autonomic system and your autonomic system and anxiety. So I think, yes, there's a definite possibility that this can be a major contributing factor to a lot of the symptoms you're experiencing.
Yeah, I have this weird feeling in the middle of my eye. It feels like light doesn't get where it's supposed to get, I guess.
Mm-hmm.
And uh, yeah, I just feel like it makes a lot of sense. The optician also, like, I'm not able to do vision training, for example, because of it, and
Yeah.
it's very, yeah. So it makes sense. But I have another question also. It's a bit different though. But
Sure.
so if you have any like medication or something that makes you drowsy and stuff like that, and you have to like push yourself kind of hard in order to stay consistent with the concussion fix stuff, is it can that be a bad thing? Like if you have to force yourself really hard in order to stay consistent because of that medication's effect, because it makes you drowsy. You have to force yourself to, okay, I need to stay consistent. I need to get through this. And
So
yeah,
basically, you're saying that the medication's making you too drowsy or making it more difficult to stick to.
yeah, yeah. Right now, it's like in winter time, maybe it gets worse or something like that. I'm gonna trample down on the medication. I'm currently waiting on a waiting list or whatever, but it takes a long, long time. So it would be cool to like if there's a way to do it through like a person on the internet or something. I don't know if that's you have to do it through. I have to wait months basically, and I know that if I trample down on that medication, I'll get much more energy. And yeah, I mean,
Yeah, I remember you reached out to yes, and you want to taper off a medication, is that right?
exactly.
Yeah, and it was prescribed by a physician. We always recommend, we can't offer any advice on reducing medication because we are not a prescribing physician. But depending on what the medication is used for, sometimes it's really essential to do that with a healthcare provider or whoever prescribed it because, sometimes reducing the medication on your own can have side effects you didn't expect. There might be a certain way that that medication is prescribed that needs a certain taper method. So, we always just advise when it comes to medication to make sure you're doing that with supervision from your provider. It's just that I'm understanding that that provider isn't available for a while.
Yeah, I'm just asking like, is it okay for me to force through things? Is that a bad thing? If you're going on something that makes you drowsy and stuff like that.
Those are the two sort of things you're trying to sort out, right? Do I taper down from on the medication or taper off the medication or push through? Is that right?
Yeah, yeah,
Yeah, I mean,
exactly.
it could be like going both ways. So reaching out, being persistent with that provider, saying, even though my appointment's a few months away, like I really need to talk to you about something that has to do with my concussion recovery. Is there a way we could jump on the phone? Can I talk to a receptionist? Can I send you an email? I really need to get that message across.
Mm,
Before deciding to do it on your own, I would try to really advocate for yourself about that medication if you are going to taper off of it. And then on the other side of things, I mean, it's tough. And Dr. Cam might have a better comment. We, of course, want to push ourselves, but it sounds like you have to push yourself really hard. And that's what we generally advise against in concussion recovery is pushing too hard and going over your stress threshold, because that's, going to add to the challenges that you're facing. So it sounds like this medication is interfering with your ability to move through the program the way you want. So the first thing might be really advocating for yourself to check in with a provider. What do I do about this medication? Or are there other options? How can I, work with the medication I've been prescribed and continue down my concussion recovery? So it might be like a step-by-step plan. It sounds like you want that answer now, like what can you do now to get moving with your concussion recovery? But maybe there's just a few more layers to work with first. If that
Yeah,
makes
so a message like ask the pharmacist. Can I just go?
Is there like a
Yeah.
receptionist at the clinic of whoever prescribed your medication or a phone number to that clinic, whoever where the medication was prescribed? I would go directly there. The pharmacist can't change your prescription.
Okay.
Mhm.
In terms of the program and like, pushing through, consuming the content is a very small part of it. So I wouldn't be trying to like rush through like, oh, I gotta watch this video and I keep nodding off and falling asleep and really it's like you want to implement things slowly anyway. So I don't know if like pushing through is the right thinking around it, but really it's just like what can you do throughout the day as part of the section of the program that you're working on, right? For example, if you're working on, let's say, Melinda's section, you know, it's not like trying to power through and push through the material that's there. It's trying to like, let's say, take one video of that, work through that, write down the things you want to do, and then you just start doing them throughout your day. You know what I mean? So you don't necessarily have to try and push through and get everything done all at once. The slower you do it, the better. So I wouldn't be too much in a rush to try and get through everything. But that being said, if you're going to go and try to meditate and you're really drowsy, you might nod off, and that might make it
Yeah.
challenging to get anything done. Um,
Yeah, and that kind of move to movement practice, right? Walk and, breathing, ground into your feet, shift into movements for those type of things, right? And at times a day where you feel most alert, maybe that's away from when you take your medication or whatnot. So there might be a way to kind of work with it for now from some of my section anyways. I mean, some of the rehab might be more challenging, I'm not sure.
Let's say if you're like you're not consistent and you like sway off in like a couple of days, 2, 3 days or something like that. The next day, okay, now I'm gonna do the same things, or should I just kind of trample up, just, or should I try to do the same things where I was back, the same tasks as when if that makes sense, like full consistent and stuff. If I sway off for 3 days, for example, and the next day I do the same things as I did when I was. You get what I mean?
I think it's fine to take breaks here and there,
Yeah.
right? It's not like you have to start all over again if you took 2 days off, right?
Mm.
Like a good example of this, for example, is my daughter. This is just top of mind because we just did an allergy test yesterday for her. But my daughter has an allergy to cashews, and so the first time we gave it to her, her face swelled up and she was itchy, and she's 6 months old, and so the treatment was either avoid it and then carry this EpiPen. Next time you eat cashews, you could die. So that was the original treatment from the allergy specialist. Carry this EpiPen, don't give her any cashews. Then we went to this new therapy called OIT, oral immunotherapy. And what you do with that is you actually eat little bits of cashews, right? And they give you a dose and you stay on that dose for a couple weeks. And then you come in and then they increase the dose. And then you stay on that dose for 2 weeks. Then they increase the dose. And by the end of it, which took a couple years, she's now eating, full cashews. So every morning she has 2 cashews and like 5 pistachios, right? Every single morning she does this. If she misses a day or 2 or 3, she doesn't have to go back to the start of the program and start with like these minuscule microscopic doses. She just, oh, I forgot my dose for a few days. She takes the same dose again. right? Your
Mm.
body is building up this tolerance over time. And so you don't have to go back to square one, right? Sometimes if you take like a good amount of time off something like exercise, like let's say you take 2 weeks off exercise, let's say, for example, let's say you've had a flare, you take 2 weeks off exercise. Then when you go back to exercise, sometimes that dose might be a little too strong for you, but you can try it. And if it flares you up, then you go, okay, that was too much. I'm going to pull back slightly. So it's the same kind of thing. Like if she's sick, they tell us give her an illness dose, which is like half of her typical dose, right? Because she already has like an immune reaction happening right now because of some illness. So, okay, we'll give her an illness dose until her sickness is gone, and then we can ramp her back up to the full dose. So same kind of thing. If you had a setback, yeah, you may have to come back slightly, but if you've just taken a couple days off, just go back to your original dose.
Okay.
Yeah, it just adds this layer of complexity, right? I think is what you're sharing with us today is this medication adds symptoms that makes it difficult to move forward with your concussion recovery the way you want to, and that creates this sort of added layer of challenge. So it may just be continuing to work with all of your providers to make sure everything feels in balance.
Just a small question about the cataract. Can it make it so that can it have a big effect on energy if you kind of fix it? Eye problems?
I mean, you're working harder. I mean, if you're struggling with eye issues, any symptoms, you're definitely working harder and using more ATP capital. So I mean, we see this all the time when people have, visual sensitivity, they're gonna be tired. And you can sub in visual with auditory and physical. It's all the same. But, at the end of the day, that's still not an obstacle that you can overcome by, as was outlined here, gradually increasing all your exposure and your output.
And I don't know if it's necessarily like the cataract alone is causing the energy issues, but it's think about like what we were talking about the autonomic nervous system, right? If you're fight or flight, the
Yeah.
information coming in is going to make that fight or flight worse. Well, being in a sympathetic fight or flight state is a lot more energy taxing than being in a relaxed, calm state.
Mm.
And so it could be like this full system based thing, right? Like, okay, so let's go through the pathway. Cataract's an issue. It's causing visual disturbance. The visual disturbance feeds the autonomic system because your nervous system doesn't feel safe. That autonomic dysregulation is going to start to impact your gut and create kind of systemic inflammatory issues, possibly hormone issues, possibly sleep issues. So you're not able to clear inflammation, which is then going to increase the amount of anxiety you have, which is then going to increase the amount of fight or flight you're in, which is then going to just continue to cascade and wipe you out from an energy perspective because it's like your system's working so hard to deal with these issues, right?
Yeah.
And there could be multiple overlapping issues, right? It's not like if we were okay, if we get the cataract surgery, everything's just going to automatically resolve. We don't know if that's the case or not, but any type of additional stressor that's on your body is going to make recovery more challenging. And this is definitely one that could be a barrier.
Yeah, okay.
But I
Thanks.
would talk to your eye doctors about that.
Yeah, I think about when I take the operation, I don't get any like zoom in effect with the left eye when I am done with it. And I wonder if that has any complications, but I think it's a lot better than the situation I'm in right now. But yeah,
It's
I've
it's a tricky
decided,
one.
so yeah.
It's a tricky one, right? So I would make sure you weigh all the pros and cons, like what's it going to be like after, what are the challenges with this being so young and having it done? Like you have to really kind of talk to multiple different people, get second opinions, third opinions, really do your research on this because you can't undo it.
Yeah. It's very like the cataract is the most unique. No one has seen it before. So it's kind of like, but yeah, thanks.
You're welcome. Good luck.
Yeah, good luck.
It's a tricky situation for sure.
Great. We have one last question in the chat here that we can do. They were saying, my physio has recommended isotopic electrolytes. Is it okay long term? I find they help me when I'm ready to crash. I have been taking them for 7 months every day.
No issues there. Good to go. Yeah. Electrolytes are one of the few things you can take regularly. I think we underhydrate. I think electrolytes help us retain water, drive water into our cells. And yeah, those probably sound fine.
Great. I think that's a great spot to wrap it up for today. Just looking at the time. Thank you for the great discussions. I know we had a few questions at the end, but some really, really great discussions from in the chat. And so hope everyone has a fantastic weekend. Bye, everyone.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.